Assalamu alaikum, this is Dr. Wakas. Welcome back to another video. In this video, I'll be discussing about one of the most important topic, which is NHS interviews. So I'll be making a series of 2 or 3 videos regarding this topic. In this video, I'll be discussing about what is the structure of NHS interview and what will happen in an NHS interview along with some tips. Okay, and in another video, I'll be telling you how to actually prepare for an NHS interview. Okay, so let's start. So the question is, what will happen in an NHS interview? For example, Alhamdulillah, you get shortlisted for an interview. You'll get an email from the HR that you are shortlisted for an interview and your interview will be held on that specific date. So usually after the shortlisting, the interview usually held in 10 to 15 days. So you will get 10 to 15 days for the preparation of an interview. So don't worry about that. Okay, so what will happen in an interview? You'll first of all, you get an email from the HR that your interview will be held remotely via the Teams, via the Zoom, and whatever the platform. So your interview will be held remotely online meeting, for example. So nowadays there are no physical interviews, so most of the interviews are remote based interviews, so they are done remotely. In an email, it will also be mentioned that who will be in your panel that will take the interview. So your panel mostly include 3 person, 1 consultant, 1 registrar or reg, and 1 service manager, and most of the time there are just 2 people, like consultant and the service manager. So this will be your panel who will be interviewing you on your interview date. So for example, your interview date is today. So what's going to happen? So you will open your laptop on a designated time, you will join the meeting, and then you will have a video call with the interview panel. The interview panel will be sitting in front of you, 1 consultant, 1 service manager, and 1 reg, and you will be sitting in front of them on your laptop. So just make sure a pro tip is here. Just make sure that you are well dressed for an interview. Try to wear a formal dressing with the coat and with the tie so that you make a good impression on the panel. So it's very important. And the second tip is, which no one told me, during my first interview, I was on my laptop and the interview was started and they were asking questions. And whenever they asked me some question, I was like this, because I couldn't hear what they are saying. The problem is I wasn't using any headphones, so this is the biggest mistake what I did in my interview. So you don't have to do this, okay, to listen to their question. That will create a very bad impression. So try to use headphones or best headsets during your interview. This is a pro tip for you. I failed my interview just because of this, even though I answered the question, but I was not wearing headphones, so I wasn't able to properly hear what they are saying. So just try to make sure that you're wearing the proper headphones, hands-free for that, and also try to make sure that the camera you are using on the laptop is of good quality, so they will be able to see your face and your expressions clearly. Okay, so try to wear proper dress, use proper headsets, and use proper camera or laptop along with the proper internet connection. Okay, try to arrange a backup internet connection as well, because sometimes during the interview the electricity went off, the internet went off, so you might have a backup arranged already. So these are the few tips which you should be doing before going into an interview. So let's start what will happen in an interview actually. So in an interview, the panel will ask you questions. So what are those questions, how to prepare for those questions, I'll tell you. So for a standard NHS interview, either it's a training job or a non-training job, the interview consists of 7 parts. Okay, so the first part is always the introduction. In an introduction, the panel, one of the members from the panel, they'll ask you simple question. Doctor, could you please tell us more about yourself? Kindly tell us about your CV. Kindly walk us through your CV. So this is your first impression. Okay, so this is the chance to create your first impression. So try to make a very good answer for 1.5 minutes for your introduction, and try to give this answer to a consultant or to the service manager, whoever is asking. Another thing is, try to make eye contact with the panel. How will you make the eye contact? You won't be able to make the eye contact when you're viewing the screen. Okay, to make eye contact, you have to see your camera. Okay, so when you are seeing your camera, your eye contact will be with the person who is asking the question. Okay, this is another tip for an interview. Don't look on the screens, look on the camera. Okay, so after the introduction, let's move to the second portion of the interview, which is very common, clinical questions. So one of the clinical member, consultant or the reg, will be asking you a clinical scenario. So what will be in the scenario? For example, he will ask you like this: Doctor, you are one of the doctors in the ward, and one of the nurses came to you and asked you that one of the patient has developed a fever, and could you please kindly go and assess the patient? So what will you do as a doctor there? So you have to prepare a proper answer according to NHS and GMC guidelines, and tell the examiner or the consultant what would be the answer and what will you actually do. So this will be the clinical scenario portion. Okay, so let's move to the third portion, which is basically behavior or competency based question. Okay, so they will ask you question related to the teamwork, communication, conflict, GMC good medical practice. For example, they can ask you a simple question: doctor, have you had any conflict in your workplace before? How do you manage to resolve that conflict? So this will be the third question they can ask, third portion of your interview. And now move to the fourth portion of an interview, which is basically NHS trust based questions. Okay, so trust based question, they can ask you simple question like what are the trust values of this trust. For example, you have been shortlisted for an interview for the King's College London. They will ask you, doctor, do you know what are the King's College London NHS trust values? So this will be available in the job description. Don't panic. In every job description or person specification, there will be clearly written on the what are the trust values, or you can simply go to the trust website and you can check the trust values from there. Now let's discuss about the fifth portion of the interview, which will be the ethical scenario. Okay, they will ask you question related to the medical ethics. Okay, what are those questions? For example, they can ask you, doctor, do you know what will you do when you come to your ward at 8 in the morning and one of the consultant you see he's not being himself, and when you went to that consultant he's smelling of alcohol? So what will you do as a junior doctor? So you have to answer the question according to the GMC guidelines. Okay, so prepare a good answer according to that. So this is the fifth portion, which is ethical related scenario. And the last portion, which is the sixth portion, in that portion he will be asking you questions related to the job or related to your career perspective. For example, he can ask you a question: doctor, why do you want to do this job? Doctor, why do you want to do this job in this trust? Doctor, what experience do you have relevant to this specialty or this post? Doctor, what are your career perspectives? How do you see yourself in the next 5 years or the next 10 years? So this will be the sixth portion of your NHS interview. Okay, so let's move to the seventh portion of your NHS interview, which will be the end of interview, and the interview panel will be asking you, doctor, do you have any questions for us? So this is the game changer for an interview. For an NHS interview, no one will tell you this thing. For an NHS interview, if you want to succeed in interview, this is where you have to ask questions. Okay, so if you are finishing an interview just by saying no, I don't have any question, it means you have already failed the interview. Okay, so when the panel or when the member asks you, doctor, do you have any questions for us, just try to ask questions. Okay, try to prepare 4 or 5 questions already. This is your chance to show them how passionate you are for this job. This is a chance to create an impression. Okay, so please don't make this mistake. You have to ask questions. Okay, you have to ask 3 or 4 questions. I'll give you an example. Okay, you can ask question related to the job. What will be I doing in the ward as this doctor? What will be my teaching perspective of the job? What will be my career after 2 years in this job role? Will I be upgraded? What will I be giving any shadowing during the period? So this is the type of question you can ask. Who will be my clinical supervisor? Okay, so this is the question you can ask in an interview when a panel asks you about the, do you have any question? Also, you can ask about the salary, you can ask about the start date, whatever. But this is the important question you should be asking. Okay, please don't say no to this segment. So this is the structure of an NHS interview, which includes 7 segments, which I have mentioned already, and also have told you what will happen in an interview. Okay, so don't forget to watch another video how to actually prepare for an interview. I'll be making a video soon about that. Stick back to my channel, subscribe, like and follow. Inshallah, we'll see you in another video.